Good morning. I'm January Contreras, the Assistant Secretary for the Administration for Children and Families at the U.S. Department of Health and Human Services. Losing a parent or caregiver under any circumstance can be a tragic and life-changing event for a child. Every child will experience this loss in his or her own unique ways. We know how hard the last few years have especially been. The COVID-19 pandemic and fatal drug overdoses alone have tragically resulted in increased losses, with hundreds of thousands of children losing a parent or a caregiver. During 2020 and 2021, it is estimated that more than 200,000 children and youth in the US lost a caregiver due to COVID-19 alone. Additionally, since 1999, more than 932,000 people, many of whom were parents and caregivers, died from drug overdoses. These traumatic losses have been disproportionately felt in communities of color. These losses often left children and families unable to say goodbye to their loved ones, leaving even more trauma and long-term grief. At the Administration for Children and Families, our hearts are with each of the children and families who have gone and are going through this mourning. Supporting the children and families who have experienced loss, it's deeply embedded in the work we do every day at ACF. It's a necessary and urgent part of addressing the impacts of the pandemic and overdose crisis being felt daily across our nation. Individuals who have lost a parent or caregiver experience a variety of emotions and needs during their grieving and the recovering processes. ACF is committed to partnering with states, tribes, territories, local governments, and community partners to ensure that those experiencing loss are supported and connected with the services and resources they need to help recover from these traumatic events. Today, ACF is delivering a Dear Colleague letter, which provides information about valuable resources available to support children, youth, and families who have experienced the loss of a parent or caregiver. Realizing that we all have a role to play in supporting communities and that grief and loss look very different person by person, family by family, and community by community. This letter highlights ways that people and human services professionals in particular can take action to be there, to provide essential supports in areas that matter to supporting our children who are left behind. This includes supports that are related to economic stability, behavioral health and trauma, kinship and family, and early childhood development. To all the young people and parents and caregivers who have experienced loss, especially in those communities who are experiencing the highest rates of death due to COVID-19 or overdose, please know that we see you and we are here to support you. We are carrying you in our hearts, and we're doing the work that's there to support. At ACF, we encourage leaders and decision makers at all levels of government and in community to maximize use of the resources that are available. Engaging with young people and families in your own communities who have experienced loss to ensure that they are informed and feel supported in a meaningful way for them and their peers. As always, we thank you for joining ACF in our mission to help all children, youth, and families thrive. And we especially thank you for your role in supporting those who are experiencing traumatic events like the loss of a parent or caregiver. Please take care of yourself and each other. We are here as your partner. Thank you.